Association of Free and Charitable Clinics. On behalf of our board, our members, and the 1,200 free and charitable clinics across the United States, I thank you for having me here today to give you our thoughts on how limiting the charitable deduction will dramatically and negatively impact our ability to provide quality health care to those who need it the most. The mission of the National Association of Free and Charitable Clinics is to broaden medical access to the underserved, as well as to promote volunteerism and to support the free and charitable clinics across the country. However, I believe that it is our broader vision that activates our donors, our volunteers, and the communities that we work with every day. And that vision is to build a healthy America one patient at a time. Many are surprised to hear that there are 1,200 free and charitable clinics across the United States who have been standing in the gap, providing health care to those who have fallen through the cracks of a broken healthcare system. Our clinics believe in giving a hand up, not a hand out, and we are organized at the grassroots level, not at the government level. So what does that mean? That means that the charitable deduction is incredibly important to us because we receive little to no state or federal funding. We are not federally qualified health centers, so that means we do not receive HRSA 330 money. We are not rural health centers. And as I said before, we rely heavily on the donations of individuals, foundations, and grants to keep us going. Some interesting facts about our donors. We're split 50-50 between men and women. Our donors give $1 to $100. And we also have done a survey of our donors, and 44% of our donors have said that they will stop giving to our organization if the charitable deduction is gone. Some interesting impacts and stats about our clinics. 44% of our clinics have an operating budget of under $100,000. 83% of our patients come from a working household. And we have found, because of a recent Penn State study, that free and charitable clinics patients are utilized the emergency rooms less. They don't overcrowd our emergency rooms because of colds or bumps and bruises. And because of this, we have proven to be a very good return on investment for our donors. In fact, for every dollar that is donated to a free or charitable clinic, there are $5 in services that are given to patients. Free and charitable clinics are volunteer run. We activate an army of volunteers to provide the health care that, quite frankly, many do not get right now in this country. One of the greatest misconceptions of the Affordable Care Act is that every single person in this country is going to have health care coverage after its implementation. And you and I know that according to the Congressional Budget Office, there may be as many as 30 million people without access to health care. That includes documented, undocumented, and those people who are eligible for Medicaid, but their states are not going to be expanding that. Because of this, free and charitable clinics will remain an important and critical part of the safety net. And that is why we are urging you to not limit the charitable deduction. We are asking you to not put a damper on the generosity of the American people. And we are inviting you to join us in our vision and help us build a healthy America one patient at a time. Thank you.
Thank you, Ms. Busby. Mr. Wentworth?